pediatric basic life support. Just like the adult life support, we need to do the right things at the right time so that we achieve return of spontaneous circulation. In pediatric basic life support, when you approach an apparently unresponsive infant or pediatric case, you need to follow the basic steps. In the first point, we are going to discuss how to differentiate the infant and the pediatric age group. So any individual up to 12 months we consider as infant. So from 12 months to appearance of puberty we consider as pediatric age group. So first we are going to discuss the infant basic life support. In infant basic life support, when you approach an apparently unresponsive infant, you check for response on the foot end of the patient. For example, on the sole of the foot, you tap on the sole of the foot. Once you tap on the sole of the foot, if the baby is not crying or doesn't move, that means something is wrong, and you immediately activate the code blue. After activating the code blue, you check the pulse. So in an infant, you check the pulse of the brachial artery. Brachial artery is in the upper limb, so you either check the left or right side brachial artery, and you simultaneously check for respiration. If you are not able to get a brachial pulse and at the same time you are not able to see chest rise, then the baby might be in cardiac arrest, and immediately you start the CPR. So the technique of CPR is slightly different from the adults. So we have the two thumb technique and we have the two finger technique. So either ways, the target is to give high quality chest compressions of at least 4 centimeters depth. So in the two thumb technique, you encircle the infant, you hold the infant with both your hands and you put the thumb in the center of the chest between both the nipples, and you give 100 to 120 compressions per minute. And the compression to ventilation ratio is 15:2 if 2 rescuers are there, and it is 30:2 if there is a single rescuer. This is very important. In infants and pediatric age group, we need to prioritize good quality breaths. We need to prioritize good quality breaths, because in pediatrics and infants, the cause of cardiac arrest is most commonly hypoxemia. So you have to focus on giving good quality breaths. So if you are 2 rescuer situation, then you need to give 15 compressions and 2 breaths in infants. Okay, and you have to give it in the center of the chest and depth of at least 4 centimeters, rate of 100 to 120 per minute. So if you are all alone, you can give 30 compressions, 2 breaths. But if you are 2 person, you give 15 compressions followed by 2 breaths in infants. So this is the most common position. You either have the 2 thumb technique and you either have the 2 finger technique. In the 2 finger technique, you are using your 2 fingers and placing it in the center of the chest between both the nipples and giving compression. So you can use any of the techniques that you are comfortable in. Ideally, if you are 2 rescuer, you should use this 2 thumb technique, because this generates more effective compression and also reduces your arm fatigue.